Welcome back to the next appraisal tool modules. In this module, we will be discussing question number 25. Is the applicability of the findings clearly discussed? Including the bullet points, do the authors discuss generalizability of the findings and clinical meaningfulness? Authors will typically provide this type of information in the discussion section of an article. Very simply, generalizability refers to how useful the results of a study are for a broader group of people or situations. So if the results can only be applied to a very narrow population or in a very specific situation, the results have poor generalizability. Generalizability is influenced by the limitations of the study. If a small sample was collected from one setting in a sparsely populated far northern U.S. state, then the results may not reflect trustworthy findings that are applicable to individuals in a large, densely populated metropolitan area in Texas. Again, as a reader, you are looking to see what the author reports about the generalizability of their study's results, and if they discuss whether they limit the applicability to just a similar population used for the study. There is a difference between generalizability and clinical meaningfulness, and we point this out because the author may decide to discuss their results from a clinical meaningfulness perspective. Clinical meaningfulness or relevance to a specific clinical situation is the more practical importance of the findings and whether it has a real, genuine, or noticeable effect on clinical outcomes. The clinical meaningfulness of results involve the elements of patient values and practicality concerns. Again, the intent of this appraisal question is to determine if the author is clearly reporting to the reader how the results apply to individuals, groups, or settings other than those directly studied. There should be some reference towards the end of the article that pertains to the author's interpretation of to whom these findings are pertinent and why. Here is an example from a published article. Notice in this brief example that the authors state healthcare workers are positioned in a key role to encourage networks of social support, alluding to the clinical meaningfulness. However, they go on to explain that the small sample and single site in a Midwestern setting reduces the generalizability of the findings beyond certain populations. Thus, they explain that replication of these pilot study findings need to occur to increase the generalizability or the belief these findings are trustworthy among other populations. In forming your appraisal response, decide if you feel the authors provided a clear description of the study's results related to how they are applicable to others not directly involved in the study. Do you feel they provide the reader with an understanding of how these findings may or may not apply in a more broad sense? Do they discuss the clinical meaningfulness of the results and findings? Formulate your honest appraisal of how clearly the authors discuss these appraisal elements. Congratulations! You have successfully completed this module and the last appraisal question on the next appraisal tool. You may return to the main menu or continue to other appraisal modules in the next EBP course.